And good afternoon. I'm Dr. Deuk. We're getting ready to perform a procedure. I need numbing medicine called the Deuk plasma. I'm going to give you some numbing medicine, Rhizotomy. I'm just talking to my patient. He comes to us from Austin, Texas. He has pain in his back. We thought it was a herniated disc, but the reality is that it turns out it's not. His pain's coming from his facet joints. And as such, we need to treat those facet joints rather than the disc. If you look at his MRI, he's got a bad disc herniation at L3-S1. And shot. Shot. All right, Luis. We're pretty much ready for you. Shot. You can see the tip of the needle is exactly where it's supposed to be for a rhizotomy. So what's happening here is he has pain coming from these joints called facet joints. Facet joints account for about 11% of back pain. In patients with chronic back pain, 11%. And the pain is pressure wipe. Let me have it. Wipe. The pain is typical back pain. You feel it in your back, obviously. Shot. And the pain actually is associated with movement and activities. And the most common cause we now know is something called the facet joint. The disc. The second most common cause is the facet joint. Now when people have facet joint pain, there's a small nerve that runs from the facet joint over to, it runs to the facet joint. It runs from the foramen along the transverse process to the facet joint. And we call that nerve the medial branch of the dorsal ramus. It is the transmitter of pain from the facet joint to the brain. If that nerve is not there, then there is no pain. So somebody much smarter than me figured out a long time ago, hey, let's get rid of that nerve. And then the patient won't have any more pain from their facet joint. Shot. So that was the birth of the rhizotomy procedure. The spinal rhizotomy, of course. Shot. And what rhizotomy means, rhizh is nerve, otomy is to kill. Can you see what I'm doing? You need to be watching so you can know what I need. That makes sense? Otherwise it just adds more time. So rhizotomy is to basically cut the nerve, and it's a standard treatment for joints that hurt. The spine is no exception. Shot. So we do rhizotomies, as do other doctors. And of course, the most common way to do a rhizotomy is to do something called a radiofrequency ablation. Now, radiofrequency ablation has been around for years. The problem is, with radiofrequency ablation, they don't last, and many times they don't even work. So at Deuk Spine, we started to ask why. Why? Why do they not work? Why do they not last? Shot. And we figured it out. It's because the radio frequency ablation doesn't actually deaden the pain nerve. It just phases it temporarily. And while that's good for the doctor doing the procedure, because the doctor gets to do more of them, it's not good for the patient. I'm going to do a stitch.
I want to, please. Yeah.
Coker? A shot? 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 Well, huh? Yeah. I don't know. Shot? All I know is he is tightening up. Shot? Shot? All right, good. So I'm just marching along the TP a little bit, making sure we get that nerve, because that nerve is what's causing his pain.
Thank you.
The nerve is not the same as the nerve root. Many people think we're actually damaging the nerve root, but we're not. You never want to damage a nerve root. Nerve roots are special, important. They control motor and sensory function in your legs, arms. We never want to injure a nerve root. We always want to just get rid of nerves that actually are just pain nerves. And that's what we're doing here with this procedure. So, turns out our patient, move your hand, did not need to have his disc operated on, because the disc was not the cause of his pain. It was his facet joint. Now, you can imagine the surprise for the patient and me, but the physical exam never lies. The physical exam is the most important diagnostic tool we doctors have to figure out where back and neck pain come from. Without the physical exam, you're lost. And maybe you just start operating on pictures, like MRIs. But in the end, move other side. The MRI will never tell you where someone's back pain's coming from. You have a roll? No? It's fine. Shot. All right, so I got to go up. Yeah. Now, I can tell you right now, after this procedure is done, if he hurts at all, shot, it's going to be from some muscle bleeding, some blood in the muscles. Shot. 3, 4, 5. Huh? Shot. Thanks. Shot. Seems awfully close, right? Shot. That should be it. It's too low. It's strange. Shot. 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 Hitting the facet. Shot. Too high. So to do this, you have to actually be right on the transverse process. It's very strange. Shot. 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 So a little bit better. Even though I see it on the x-ray, I'm not feeling it. You know? It's very odd. And he may have some scoliosis as part of the reason. Sean? That's facet. That's TP. Shot. That's better. The fucking hell. So I need to get more medial. It's better. Right about there should be good. Let's see. It's too low. And it's just sliding right over the top of that TP. Shot. And again. That's the perfect spot right there. Had to struggle with that one a little bit, getting in the right spot. Pressure. Hold it down. Give me an opening. There you go. Nice. Okay. Off. Shot. 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 That feels good. Shot. And shot. Still feeling bone. How's he doing? Great. Shot. And shot. Just the slightest movement. It's so strange because his TPs look fine on the x-ray. And then you get here and they're so hard to tag. It seems to be helping. Shot. 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 Feel the bone. You gotta feel the bone. It's very important. Shot. That's the perfect spot right there. That should do it. Next. Shot. Need to be a little lateral. Shot. Shot. That's not bad. Go ahead. Shot. Any question?
No current questions.
Shot. Shot. Yeah, his muscles are just jumping a little bit, but I think we're fine. Still getting a good burn where we need to. Shot.
We have a question from Jules on Facebook.
Shot. Jules.
They asked, "What's happening? What's happening? What operation are you doing?"
So, a second most common cause of back pain comes from the facet joints, which are little joints in the back of the spine. They're paired right and left. And in this particular patient, that's where his pain's coming from. You see a lot of surgeries done here on discs. He had a herniated disc at L3-S1, but when he came here, I realized he didn't have pain from the L3-S1 disc. His pain was coming from his facet joints. So to confirm that, we did a medial branch block. Go ahead. Which is where we go in and numb up the facet joints to see if it takes the patient's pain away. That gives us a diagnostic test. And sure enough, his pain went away. So I told him, listen, your disc is not causing your pain, it's your facets. And that's what we're doing. We're treating his facets today. These joints get injured, then they start to hurt. And very common. Of all the people with back pain in the world, it's the second most common cause. And specifically, they account for 10% of all back pain. So if you know somebody with back pain, actually if you know 10 people with back pain, then one of those people, 10%, the pain is coming from their facet joints. And that's what we're treating, facet joint pain. So to do that, I have to go in and burn this little nerve. And it's not the nerve root like you'd think. A lot of people get mistaken about that. You don't want to burn the nerve root. But we're burning a small nerve to the joint. And that nerve is called the medial branch of the dorsal ramus. One more. Shot. And it lives right there on the x-ray. Jordan, show them where the medial branch of the dorsal ramus lives. Right there where my tip is. See that? And so I am literally trying to kill that pain nerve. And that's what we're doing here. And we've got, well, 7 of them done. We've got 1 more to go. And that's what we're doing. And it's all being done through these tiny little cuts on his back. Shot. Two on each side. These cuts are 3 millimeters. And this is an outpatient surgery. He's gonna go home after he wakes up, which will be in about 5 minutes. We'll keep them and watch them. There you go. Go ahead. We'll watch them for about an hour and then we'll send them home. So this is an outpatient surgery. It's called the Deuk plasma rhizotomy. And basically, we have modified the rhizotomy procedure that other doctors do in order to give a more lasting result, a more effective treatment. Shot? Because other doctors do rhizotomies, but they don't do them like this. They do them with a needle, and that it always wears off. So it doesn't have a lasting result. We want our patients to have a lasting result, one that lasts the rest of their lives. So we developed a new technology. Shot? It's called the Deuk plasma rhizotomy. And using this, the energy of plasma energy is very powerful. Concentrated at the tip of this probe, we are deadening the pain nerves. Deadening the pain nerves that go to his facet joints. Jordan, show the audience the facet joint. There's one, and show the one below, L3-S1. Yep. See that, guys and gals? We're done. We're all done. Okay?
Lights on, please.
So, why don't you do a steri strips and then just do a pressure dressing?
Yeah, you don't need
We don't need to put a stitch. It's too small for a stitch. And you can see, folks, let's just show them. This side, hold down. Yeah, well, here is one cut, and here is the other. And that's his left side. We did 2 cuts on the right side. And it looks beautiful. He's a very nice, fit young man. He should make a complete recovery from the surgery. Any questions?
No current questions.
All right, just to reiterate, this is called the Deuk plasma rhizotomy. It's a new technology used to treat pain, back pain that comes from facet, F-A-C-E-T joints. So look up facet joint pain. The standard treatment that everyone else does is called a radiofrequency ablation, RFA. The problem is they never last. Patients always come back. And we don't want our patients having to come back. So we've developed a more permanent treatment that basically targets the pain nerve in the same place as an RFA, but then we sweep our probe around so that we get a bigger burn area, so we're more likely to burn the bad nerve, the pain nerve. And also we burn with more energy, so it kills the nerve permanently. So we're more likely to hit the nerve and we're more likely to destroy the nerve permanently with this procedure compared to an RFA. I think in the future everyone will be getting this procedure. Great job, everyone. Thank you.
Before we go, we just have one question. This comes from Marcus on YouTube. And they ask, can facet joints also contribute to pain in legs or at least below the back?
Yes. So great question, Marcus. Facet joints are commonly known to refer pain down into your thigh and up down to the knee, but they never go past the knee. Facet pain doesn't go past the knee. And Marcus, facet pain can actually cause so much pain that your muscles in your back will tighten up and they'll compress the foramen where the nerve comes out and actually cause radiculopathy in some patients. Or the inflammation from the facet joint will spread to the nerve root, which is right in front of the facet joint coming out of the foramen, and cause radiculopathy that way. But the best thing you can do is to get your MRI to Deuk Spine. We have a free MRI review. It's MRI.DeukSpine.com, I think. Henry, you put the link there, and you can use that to get a free MRI review. All right, signing out. Thank you. You can end the stream.